All right. So, welcome everyone. Before I introduce our speaker, let me mention a few items. Please keep yourself muted, but keep your cameras on as we'd love to see you all. If you have questions, you can start adding them to the chat at any time during the presentation. And of course, we will go through those at the end. Once Dr. Catalanotto is finished with his slides, we will share a slide with a QR code that will bring you to a survey that is required in order for you to get your CEs. We will upload your CE to CE Broker, or I'll upload your license and your name to CE Broker, and then you will get a certificate via mail. After we do that, then we can go into the questions. So, yeah, it was, now I'm going to have to stop and admit. It is with great honor that I have tonight speaking for us, Dr. Frank Catalanotto. Um, he is a pediatric dentist. He was the past dean at the University of Florida College of Dentistry and chair of the Department of Community Dentistry. He just retired as professor emeritus in community dentistry and behavioral sciences. He is highly respected leader in the community of dentistry, dental education, and health equity reform, and is the president and founder of the Floridians for Dental Access, the coalition that is driving dental therapy legislation in Florida for the past 8 years. So Frank, welcome, and thank you so much for being available to do this presentation for us.
Thanks, Kathy. It's great to be here with all of you folks. So before we get started, I just want to give you a heads up. There's a lot of slides. I am not going to be rushing through them. But they are going to be sent to you in addition to the recording, so you can see the details that are on them. Here's some of the topics that we're going to try to cover. I'm going to just briefly mention the data about how bad things are in Florida. We're going to talk about what a dental therapist is, how they get educated, the scope of their progress, the national progress that is happening in dental therapy across the country. And actually today I just had a meeting at 1 o'clock with the national group, getting some updates on what's happening across the country. What the legislation that we are promoting allows in terms of a pathway to get dental therapy licensure in our state. I'm going to a few minutes talking about what I call them, to be polite, the myths and misrepresentations about dental therapy from organized dentistry, and obviously in our state, that's specifically the Florida Dental Association. I'm going to sort of close with get in the legislature and what we're going to do to make this happen with your help, I hope, next year. And then a little bit about our organization. So, anyone want to guess what the answer to this question is? Florida's oral health is the worst in the nation. And there's lots of data on the next couple of slides. You can study them at your leisure. If you have questions afterwards, you can reach out to me in the Q&A period or after this webinar is over. I'm going to leave plenty of time for questions near the end. The key thing to remember is that there are specific populations that suffer the worst oral health, poor families, communities of color, the elderly, immigrant populations, and in particular those with developmental disabilities. For those of you who are on the mailing list for Floridians for Dental Access, we're going to be publishing a story in 2 or 3 days about patients with IDD. What's the main reason why people have difficulty accessing dental care? It's cost. It is nothing more than cost. Dental care is just really expensive. And then when you add to that fact that only less than 20% of Florida dentists accept Medicaid, and Medicaid reimbursements are low, it's easy to see why we have the problems that we have. The number one unmet need in the state. This is actually probably nationally also. And tooth decay is an epidemic in children. I literally yesterday just got the 2021 third grade surveillance study. I haven't even had a chance to look at it yet. But basically, one of the highlights is that about one third of the children, 30% of children in Florida have an unfilled cavity. And when dental care is too expensive, what do patients do? They go to the hospital emergency department where they're required to see them. Um, Again, I'm not going to go through the details on this slide. You can look at them a little bit later on. There's one data slide I do want to share and look at, and that's this one here. Um, we rank last in the country in terms of the percentage of children. This is all children now. This is not just Medicaid kids. We rank last in the country for children, the percentage of children who had a dental visit in the last 12 months. That's just awful when you think about it. And for adults, we rank in one third of the country in terms of folks who have had a dental visit. Um, Dental therapy is a proven solution to increase access to care. It's important to understand 100% of the scientific literature supports quality, safety, cost effectiveness of dental therapy. So let's discuss what dental therapists are. I love this slide. Okay. Dental therapist conjures all sorts of images up of what does that mean? Is this someone who talks to you about the psychology of dental disease? No. Um, what are dental therapists? They're oral health professionals. They work on the team with dentists and dental hygienists. They must be employed by a dentist. They must be under the supervision of a licensed dentist, and in our state, a Florida licensed dentist. They provide evaluative care, preventive care, restorative care, and minor surgical care. I'll get a little bit more into the scope of that in a minute. This profession is over 100 years old. It's been used in 50 countries. It started in New Zealand. It's now in use in about 50 countries around the world. It's been in the United States about 20 years when it was started by a tribal organization in Alaska who just got tired of the lack of service they were getting from the Indian Health Service. And they sent a group of young men and women to New Zealand to study for 2 years. And they came back and they started providing care. At that point, they then opened their own educational program. That's when I heard about this. And I called them up and said, this sounds interesting to me. I was interested in access to care. And before I knew it, they invited me up for a very bleak week in December. Not a good time to be in Alaska, but I had a wonderful time visiting with the students and the faculty for a week and became absolutely convinced that this is a great way to improve access to dental care. Dental therapy is now authorized in 14 states, and dental therapy educational programs have to be accredited by the Commission on Dental Accreditation, the same organization that accredits dental hygiene, dentists, and so forth. Okay, so a couple of details about what they can do. So in terms of evaluation, they can expose radiographs, they can do examinations, they can treatment plan. And then where necessary, they can obviously refer patients that are beyond their scope of practice. They can do all the preventive procedures that do as a dental hygienist. In terms of treatment, the way to think about the restorative treatment that they can do is they can do one tooth restorations. So they can't do bridges, they can't do implants, they can't do dentures, they can't do root canal therapy, they can't do periodontal surgery, all right? But they can prepare and place fillings, um, preform stainless steel crowns. They can extract primary teeth. They can extract permanent teeth which have a +3 mobility. They can dispense and administer non-narcotic medications, and they can provide local anesthesia. Where can this work? And this is based on the experience in Alaska and Minnesota, but in the States, So we're seeing them in private practices, we're seeing them in corporate practices, we're seeing them in federally qualified community health centers. There are some hospital emergency rooms that have hired dental therapists, a lot less expensive than hiring a dentist. But when patients go to hospital emergency rooms, all they normally get is antibiotics and pain medication, and they're told to go see a dentist the next day. That doesn't work because if they couldn't afford a dentist the day they went to the emergency room, they're not going to be able to find one tomorrow. So if they can get some care in the emergency room, they can work in nursing homes. All right. There's a couple of dental therapists that I know personally. So they work with fragile nursing home patients. Their real power is at the bottom of the slide. They can go into schools. They can work under the concept of general supervision. And the advantage of going to schools is that there's basically no failure rate. They are filled, their chair is filled all day long. Because if one scheduled child is out sick, there's another child to take their place. And that's the biggest power and where they're having most impact, particularly in the state of Minnesota. Are they the answer to the access problem? No, they're not. And we are not saying that. This is a puzzle of all the different approaches that we think are appropriate to look at in terms of trying to address the access problem in our country. We've got to improve the oral health literacy, and not just of the public, but of policymakers who need to understand that poor oral health impacts medical health and medical costs. Okay? Some great studies about that. Workforce solutions, more direct access for dental hygienists to be able to serve patients, and then, of course, dental therapy. Medical dental integration. We a number of years, and this is now being done in many FQHCs across the state. We placed a dental hygienist in the medical pediatrics clinic and had just amazing results, not just in terms of the direct care that the kids got in the medical practice, but those kids had lower failure rates when they went over to the dental clinic, as an example. Loan forgiveness. I support loan forgiveness programs for dentists. And now in Florida, I hope you're aware that legislation passed last year allows dental hygienists to get loan forgiveness for working in underserved areas. But loan forgiveness is not a long-term answer. It is expensive, but it's only short-term. There's no data that says that loan forgiveness gets dentists and dental professionals to stay in underserved areas. We have a pretty poor Medicaid system in our state with low reimbursement. That certainly needs to be improved. And then we just need more safety net programs like FQHCs. The problem is that those FQHCs, for example, can't hire enough dentists and dental hygienists to work in their programs. So it's a complex set of solutions. We're focusing on just one, and that is our laser focus on getting dental therapy legislation passed in our state. So how do we assure that these programs are high quality? Couple of ways. The first is that all the new programs that are coming about, there was some grandfathering in Minnesota and Alaska because they started before CODA established dental therapy at accreditation standards. But there are now a set of accreditation standards that CODA has for dental therapy, and all the programs are having to apply to get CODA accreditation. Dental therapists also must take a licensure exam. Okay. It is the exact same licensure exam that dentists take, except that it's limited to procedures within the scope of practice of the dental therapist. And they cannot operate outside of their scope, and they must be supervised by licensed dentists. But again, remember what I said earlier. It can be general supervision. It does not have to be direct supervision. They can work on what's called a collaborative practice management agreement with their supervising dentist, which says this is what they are within their scope. The dentist cannot expand their scope. Okay, that's the power that allows them to be in the office when the dentist is there. That's them to go into nursing homes and to go into schools. Okay. So what are the code of guidelines? What do they say about how you can become a dental therapist? Okay. They prescribe the topics within the curriculum. Those topics cover all the scope issues that I mentioned earlier. But the basic requirement is 3 academic years. And you got to remember, an academic year is not, it's a fall semester and a spring semester traditionally. It does not include the summer semester or 2 full-time years. Okay. And so that's what happened in Alaska. The program that started there pre-CODA, before CODA accreditation was developed, was 2 full-time years of education. Um, the the new program in the state of Washington at Skagit Community College is a 2-year full-time program. You can also get dental hygiene education after you can get dental therapy education after dental hygiene education. Okay. And so there's a program in Minnesota, Metro State. It is spread out over 6 semesters, but I don't want that to sound too scary, but it's because it's only 44 credit hours. Now, the legislation in Minnesota did something that those of us who are advocates don't like. It stipulated a degree. The ideal legislation lets the degree determination be the decision of the college. It should not be in legislation. But anyway, so the Metro State program is meant for hygienists who are already graduated, who are working and can work part-time while they're going to school and get their dental therapy education. Or you can do something that the University of Minnesota does. And again, remember, Minnesota is a state that requires a master's degree, but they provide combined dental hygiene and dental therapy education. After a year of prerequisites, they can provide this in 3.5 years. And you get a bachelor's and a master's degree. Now, for any of you who know anything about higher education, getting a master's degree at the end of 3.5 years of education doesn't sound logical. It's not. But they have to do it because the state requires that they have a master's degree. So they get that in a year of prerequisites and then 3.5 years of education school. The neat thing about the University of Minnesota is they take classes with dental students. They're indistinguishable. When they get into the clinic, they could be in a chair next to a dental student doing their procedures and completing their competencies. Okay, remember I mentioned that there's a clinical licensure examination that dental therapists have to take. So there's an OSCE, which is sort of like a simulated examination. It's not a clinical examination. They have to do a couple of pediatric procedures, an amalgam, a posterior, a stainless steel crown. They have to do some other restorative procedures, an anterior restorative and a posterior restorative procedure. I thought you'd get a kick out of this. Kathy Cabazon shared this information with us a little while ago. This is the 2024 examination. I want you to note the path from the dental therapist and the dentist, almost 2 points higher on the anterior filling and almost 7 points higher on the posterior filling. Now, for those of you who know anything about live patient examinations, um, I shared this slide with you because it was a good finding to see on the 24 examination, but there are so many variables in clinical licensure for examinations. So I don't want to make too much of this, but I just had to show it because it says something about the quality of these students. Let me give you an explanation of why we think these kinds of things happen and why dental therapists get so good at what they do. When you're a dentist, you're you've got a scope of practice that's several hundred procedures. During the day, you might do two or three fillings, you might do some extractions, you might do some implants, you might help with a denture. When you're a dental therapist, you're basically doing preventive procedures and simple, straightforward restorative procedures. You just get better at it. Okay. And that's what some of the research studies have shown. Dental therapists are better somewhat at doing these fillings because that's the primary thing that they do, as well as preventive procedures. And I don't want to underemphasize the preventive issues. They get lots more training in motivational interviewing, for example, than dental students do. Okay, here's the national update of where we are. Nothing has changed as at 1 o'clock today. We've got about 14 states where dental therapy has been approved and implemented. And in several of those states, such as Michigan and Wisconsin, which only passed their legislation a year or two ago, maybe a year ago, they've actually already got dental therapists working in the state because they planned on this. For example, the Michigan Primary Care Association actually gave a scholarship out 3 years ago, and that first graduate is already working in the state of Michigan. She's working as a dental assistant, I was told today. She's just waiting for her licensure results to get done. Um, and then there's at least a half a dozen other states, including us in Florida, that are in various stages of trying to get legislation up and running. So let's talk a little bit about what the Florida legislation does. Uh, It does not specify a degree. We leave that up to the educational institution. And I can tell you that there's at least 5 dental hygiene education programs in the state of Florida that are interested in hosting a dental therapy educational program once the legislation is passed in our state. Reciprocity. We assume that if we have a CODA accredited program, there should be no problems with reciprocity and licensure from other states where they have a CODA approved program. Um, there is a question if someone graduated from a program that now has CODA approval but did not have CODA approval, and there is flexibility for the State Board of Dentistry to approve a person if the program is considered equivalent to what a CODA approved program would be like. Um, our legislation allows for what I call straight dental therapy as the Alaska and Washington program. That is, it does not require dental hygiene. However, I doubt that any Florida programs that I've spoken to are going to do this. They're going to primarily require dental hygiene or have the combined program where you get dental hygiene and dental therapy at one time. Um, and we're working hard that's a fair amount of the time that I'm spending right now is reaching out to hygiene programs and talking with them and their college leadership. This is critical. Their college leadership about hosting a program once the legislation is approved. Also to think about affiliating with dental schools and FQHCs and safety net organizations for clinical rotations in usually the last year of their training. Um, and basically, the bottom line of the conversations that I'm having is I see 2 models. One is going to be similar to the Metro State model that I mentioned earlier, where after graduation, a working dental hygienist can enter into a program that will take, I'm hoping, less than 6 semesters because CODA does allow for advanced standing, but Metro State uh, didn't want to fight with CODA about this. CODA was giving them a hard time. We're still pursuing those conversations. And then the other is a combined program similar to the University of Minnesota, but it doesn't have to be a university that would do this. It could be any other dental hygiene program in the state of Florida. So we have a variety of pathways to get to become a dental therapist in our state. So who opposes dental therapy? I know for you guys who've dealt with opposition from the Florida Dental Association for at least the 30 years that I've been in this state, if not longer, only organized dentistry. They're the only organization that opposes dental therapy. Here's their problem. 100% of the data. Now, let me tell you what that data is. So internationally, and remember I told you it's in 50 countries for over 100 years, there's roughly about 1,000 published papers about dental therapy. In the United States alone, there are 120 approximately papers that have been published that look at the quality, safety, cost effectiveness of care provided by dental therapy. All of those papers support the quality issue. Basically, the only opposition the Dental Association has is their opinion. This can't work. I don't think this can work. I don't think this is safe. They can't be trained to do this in 3 years. Look at me. I went to school for 8 years. Okay? It's only opinion. They have no facts. Unfortunately, they do have a large PAC with a lot of dollars, and they've got an organized lobbying system in their state. I want to share one thing with you to give you an idea of how they fight. To be blunt, they fight dirty. This is a toolkit published by the Academy of General Dentistry. The ADA has a similar toolkit. And on this page, toolkit, they admit that the literature is there about the quality and safety. So what they tell their representatives is publicly don't question quality and safety. But when you get in the room privately with a legislator, and that's in this last paragraph, and again, I'll let you read the details at your leisure later on, they conjure up what I call scary images, scary stories about the bad things that could happen. Now, this ignores the fact that those bad things have not happened over the last 20 years. It ignores the literature, but it just sort of says, oh, you can sort of mislead the legislator about this. Um, I've written to the American College of Dentists about this. They're supposed to be the home of ethics in our dental profession. They told me that they didn't want to get involved with this. They use terms like irreversible surgical procedures. Guys, that's a filling in a tooth. That's cutting a cavity preparation in a tooth. That's extracting decayed baby teeth. That's doing a pulpotomy. Those are straightforward procedures that can be learned by anyone with the appropriate training and background. Again, administer local anesthesia. Hygienists have been doing that now for a number of years in Florida. It's just meant to scare legislators. So one of the things that the Dental Association says, we have plenty of dentists in Florida. This is just a malnutrition issue. My answer to that is baloney. We have the highest number of people living in what the federal government calls dental health professional shortage areas in the country. The next closest state, actually the next two closest states, come up with our total of 6 million people. We have these shortage areas in 65 of our 67 counties, and we would need more than 1,200 dentists to address this shortage. It is not going to happen. Here, we're not going to build that many more dental schools, or there's not going to be that many more dentists that want to move to the state of Florida. This is another one I hear. Oh, tiered system of care. Real dentists for the well-off and those dental therapists for the poor people. Okay, well, we've already got a two-tiered system in in our state, in our country. Those who can access care and those who can't. All right. So this two-tiered system of care baloney, I don't listen to, and I countered immediately. Another big set of lies is, well, they haven't really increased access to care. And again, I want to leave plenty of time for questions, so I'm not going to go over the details of these slides, but they use some misrepresentation of data that happened in the state of Minnesota, from when they started dental therapy to when this report was done in 2019. Okay. And basically why? Dental therapists have had a significant impact on increasing access to care in every state where we've got large enough data sets, Minnesota and Alaska being the two most prominent ones. Dental therapists perform partial root canals. Again, a lie. They perform pulpotomies. They do not perform pulpectomies. Pulpotomy is only dealing with the pulp chamber of the tooth. They do not get into the root canals at all. But again, this is a favorite lie that we hear being told to legislators. And this is something that bothers me in particular. I'm a researcher by background. So the American Dental Association have a Council on Scientific Affairs. And this I'm going to read. The results of a variety of studies indicate that appropriately trained mid-level providers are capable of providing high-quality services, including irreversible procedures such as restorative care extractions. That is from an American Dental Association committee. And it is just ignored by the ADA themselves and by state components like the Florida Dental Association. And what we call the biggest fairy tale of all, we have solutions in place to solve the dental access crisis. One of their solutions are missions of mercy. Now, don't misunderstand me. I absolutely applaud dentists and dental hygienists and dental assistants and lay people who volunteer to host a mission of mercy. Okay? I think it's wonderful that these people give it their time. But I also don't that waiting in line 24 hours overnight to get one or two teeth taken care of is a system of care. It is not a system of health care. It does not show dignity, the lack of dignity for these patients that have to do this to get their care. Even the American Dental Association says missions of charity is not a healthcare system. Philanthropy is good, but it's not a way to deliver healthcare to people. And if you look at the numbers, so we looked at the data provided by the Florida Dental Association. Over the last 9 years, almost 14,000 patients got dental care, about 1,500 patients a year. This is in a state with 6 million people living in dental health professional areas. This is in a state with 121,000 visits to hospital emergency rooms to get dental care. Okay? That is not the answer in mission of mercy. Loan forgiveness. I start loan forgiveness. I am thrilled that Florida started a loan forgiveness program for dentists a year or two ago, and now dental hygienists are also eligible for those funds. However, loan forgiveness is very expensive. The Florida funds only about 10 dentists per year to go work in underserved areas. But more importantly, the scientific literature says there's no long-term impact. After that loan forgiveness period is done, they're gone. They leave that area, they go back to practice in a more lucrative area, maybe better schools for their families, and so forth. Lots of good reasons. Okay. And then I also have heard that they couldn't even fill all the positions last year, which is just awful. Again, more dentists are not the answer. I want more people with $300,000 in debt for 8 years of education to think they're going to solve the problem and work on underserved patients. It's simply not going to happen. And we only graduate a little over 300 dental students a year into dentists. We need another solution, a workforce solution, and that's where dental therapists come in. Again, I want to remind you, the data is unequivocal. If you support our work, you need to remember and understand your support is backed by data, which says that dental therapists provide high quality, safe, cost-effective care. Now, here's the good news. Momentum is really moving on this. So, my first foray into this was 9 years ago. I was speaking with some friends. I was providing testimony in a lot of other states to support dental therapy. And someone said to me, well, why, if this is so good, how come you're not doing it in Florida? And I said, you guys have never heard of the Florida Dental Association. Remember, I've been here in the state now for 30 years. So I've seen them operate. Again, very powerful, packed, very powerful lobbying system. But I decided to try it. And we got some funding from the Pew Trusts and started to grow Floridians for Dental Access. But we've been knocked down every year, but we're getting closer and closer. Uh, Florida Dental Hygiene Association has been a partner of ours for a long time. We're now an organization that has 550 members. Those members are either organizations or they're individuals. We actually have 50 dentists who are brave enough to be on that list of dental. Um, we have a leadership group that helps guide our pathway. Um, and probably the most important change in our work came about 2 years ago when we were joined by American Children's Campaign. Look, I've done legislative work for most of my career, and I thought I knew how it worked, but in Florida, it's what I call street politics. It's rough and tumble politics. And we were joined by Roy Miller from American Children's Campaign and his team. They do some of the beautiful graphics and communication issues. We have great funding from the CareQuest Institute for Oral Health, and they fund both us and American Children's Campaign. And so we have a lot of momentum going. Sort of what happened in the legislature in the last 2 years. So in 24, the way the legislative process works, a bill has to be heard by at least two committees in the House and two committees in the Senate, and then it can go on to the floor for a vote. And in 24, we actually passed two House committees quite successfully, but we never got to a floor vote. In 25, things significantly improved. We passed two committees twice, both as an independent dental therapy bill and then packaged onto something the Senate wanted to do, which is a rural renaissance bill. And we passed the whole House. However, we had trouble in the, I'll tell you why. We have two key senators that chair two key Senate committees that we must go through unless we can find a way to bypass those committees. All right. And we simply couldn't get it to happen this past year. We have a plan for the upcoming year. Plan focuses on meeting with a lot of individual senators in Florida, and then a couple of other things we're trying to do. We've grown significantly. Just in the past year, we've grown over 125 new members. Again, that includes organizations That includes individuals, that includes dentists, that includes dental hygienists, it includes a couple of medical professionals. And of course, as was discussed on the national call that I was on this afternoon at 1 o'clock, a lot of attention is on Florida because if Florida passes dental therapy legislation, that will be the biggest state. And we've got some activity going on in New York. We've got some activity going on in California. But everyone's sort of watching Florida and hoping that next year will be our year. Why are we successful? So, excuse me 1 second. We did a public poll when we first started with American Children's Campaign 2.5 years ago. This was a sampling done by a major polling firm, and we tested out some messages about dental therapy. And our great joy, this was a bipartisan issue, as it is in many other states, with Republican voters as well as Democratic voters. Concept. We are in a Republican state, so it's really important, and our bill sponsors are both Republicans. We have a very strong public education campaign. So if you belong to Floridians for Dental Access, you're getting our social media, you're getting our web email blasts about once a month or so, once every couple of months. And we're planting stories in the press. And we sell this to legislators as what we call systemic change. This is a change in the healthcare delivery system in Florida. It's not based on charity, for example. We do a fair amount of storytelling, and that's one of the things I'm going to ask you about. And, you know, I support Medicaid expansion, but if you look at that last bullet, that's a culture war issue in Florida. It's simply not going to happen in our state. Republican legislators, think about the interest. Our Republican legislators are not going to support Medicaid expansion, but they are going to support dental therapy. Okay, they support this and they believe in this, and this is at both the state level and at the national level. The Biden administration and the Trump administration, the first Trump administration, had support for dental therapy within their agendas. Okay. Where are we now as we head into 26? We're already working now. We're still working with our bill sponsors. We have very, very strong leadership in the House. We are working on a pathway to deal with it. And we've got momentum on our side. We've got the facts on our side. We've got national attention on our side. We need to grow. If you're not a member of FLDA, I hope you will join after this webinar. This is an example of some of the organizations that are part of our membership. So what can you do to help? You can use these QR codes, or you can just go to our website, Floridians for Dental Access. You can first join our coalition. The other thing you can do is, I want to emphasize the power of stories. If you know patients who have stories about difficulty in access, ask them to share them with us. These stories are so important in the advocacy process. Here's just one from one patient. And this is something you can do in the practices where you are working, is finding stories of patients who they would share with us. So with that, I'm going to stop. Here's where you can get some resources. You can contact me directly by email or cell. This is what I do. I play some golf. I spend some time with my grandchildren and with my wife and my other children, but this is what I do. This is my full-time job now that I'm retired. So with that, I am happy to turn this back over to Kathy. I think you have some process things to do and then answer any questions.
Thank you so much. Oh, let me put my camera up. Thank you so much, Frank, for that. Everyone, I want you to look at the QR code here. Alan, can you just maybe make that larger? because it's cutting half of the code off. If everybody could take a snapshot of that. But in the meantime, please put any questions that you have into the chat, and Dr. Catalanotto will be more than happy to answer that. I did have one for you, Frank. I noticed in the beginning you did more generalized about dental therapy across the nation in the 14 states, or mostly in the Minnesota or the Alaska model. But in Florida, if they went in on the track of not being a dental hygienist first, they would not be doing perio, correct?
So no, their dental therapists do not do perio. That's why I said what I did in the beginning. I expect that the model we have in Florida is going to either be an existing dental hygienist or a combined program where you get dental hygiene and dental therapy at the same time.
Okay, great. Because that's been a question that a lot of people have asked me. Well,
Right.
are they going to, again, that fear that's been put out by the dental association, they're going to take your jobs away. So,
No, they're not going to take. So let me give you Minnesota. The best exact story I can tell you is an organization called Children's Dental Services. After 10 years, they have decreased the number of dentists and increased the number of dental hygienists in their organization with the use of dental therapists. Okay. Apple Tree Dental, same story. Increase the number of dental hygienists that work with them. So they are not what they do is grow the practice where there's more need for hygiene.
and especially with the workforce shortage, wouldn't it make sense that if we had dental hygienists that could do both, that'd be kind of cool. So I do have somebody introducing themselves. Hello, this is Andrea in the Miami area. I was lucky enough to be trained in Minnesota by Dr. Barry Kinberg, who went on to Metro State Therapist Program. I'm so excited to see your momentum here in Florida, and I want to get involved.
Great. So
Sign
actually,
up.
I'm going to host a phone call in the next couple of months with Metro State with several of the colleges in Florida because I think that's one of the best models that I can see. Although again, I'm not happy with the fact that it's 6 semesters, but it's 6 semesters part-time. So yeah, Metro State's has come back and is doing a great job.
Thank you for that. Are there any other questions?
Kathy, this is Denise Smith. I have a question. I didn't write it in.
That's okay. You can say it then.
Thank
Hey,
you.
Denise.
Hey, Kathy and Dr. Catalanato, nice to see you again.
Hi.
It's not really a question, but something that you said stuck out to me. Whenever I've talked to legislators about this, one of their main concerns is lack of quality preparation or lack of education, or they're not qualified for these procedures. And the fact that you mentioned that 5 dental hygiene programs in the state are ready to educate dental therapists. They've got a program outlined and they're ready to go as soon as it's approved. And they are, let's see, part of their requirements are you must be an RDH first. So knowing that and being able to tell legislators that, because what you hear is, what I've heard is, well, they're just going to take someone right out of high school, or they're going to take someone off the street and train them to do fillings. So this knowing that they have to do the RDH first and then DH is good to know. This is good information to take in when you go to talk to them, I would think.
Remember, Denise, or they can do it in a combined program. All right. And they
Right.
probably will still have prerequisites before that. So this fact that the statement that they don't have enough education, that's coming from the misinformation of the Dental Association. That's
Yes, but
coming from the legislators themselves. And they have but the real question I tell the legislators, well, ask them for data to show that they're not competent and they don't, there's no answer. Let me tell you one more thing about the quality and safety issue. Their malpractice insurance in Minnesota is about $100 a year. Do you think these insurance companies are stupid? Would they insure them for $100 a year if they thought they were unsafe? or didn't
Well,
provide any care.
you know
Uh,
that dental hygiene malpractice is about $80 now.
yeah, I mean, it's just roughly about
Yeah,
the same as dental hygiene in
exactly.
Minnesota. It's a it's
And
a it's a
Denise,
few dollars more.
let me add to that if you don't mind, Frank. So when they say, one of the things that they say is a dentist goes to school for 8 years. Well, dentists do not go to dental school for 8 years. They must have a bachelor's before they enter dental school, but that could be in arts. It's not in dentistry. They do 4 years of dental school to do their 500 to 600 procedures. A dental therapist would do 3 years in dental therapy school to do their 80 procedures.
Yep.
Weigh those.
Mhm.
I mean, that's shocking. When I told the
And
legislator that, they go,
that's why they're better at what they do, because they do more of those procedures while they're in
right, it's more
school and
repetitive.
then when they're in practice.
Even on the board of dentistry level, because of our scope being limited to our procedures, we don't have scope issues. The dentists have the scope or the violations because of those advanced procedures, the crown and bridge,
Yep.
the implants. It's not on fillings, it's not on basic stuff. It's mostly on the advanced procedures. That's where more of the liability and the challenges come in play.
Yeah, absolutely. Good point, though, Denise. Thank you.
Any other
Certainly.
questions? You could
Any
just
other
unmute
questions?
yourselves. All right. Well, I thank everyone for joining us. Frank, thank you always. Oh, do we want to let them know when the legislative session starts next year, 2026? We have an
So we're
early
gonna
session.
yeah, committee meetings will start in the fall, around middle to end of September, and then legislative session starts uh, after January, right, Kathy? I'm pretty
Yes.
sure it's right after January.
I think it's the second week in January, not 100% sure. But also what you can do if this is something that you believe in is meet your senators and representatives are home right now. They had the worst session they've ever, the longest they've ever. So let's give them another week or two to break. And just introduce yourselves and meet with them. If you want material, go to the Floridians for Dental Access, reach out to Frank, reach out to myself even. We can give you talking points that we've put together and just go and have those conversations with your legislators. If you don't know the answers, that's fine. Denise, you're the best about this. You always, if you don't have the answer, you go to the experts and find it and then give it back to them. It's okay to not know everything, but if we don't meet with them and express our positive belief that this is the right thing to do, they're only listening from one side. So
Yep.
it's important for us to take that initiative. And most of you on here have, there's a few new people, which welcome, thank you. But reach out to us. We can help you, either myself or Frank, and we'll connect you with whoever needs to be connected. How we work as a great team. All right. Thank you,
All right.
everyone,
Thank
for
you
joining
all.
us. Don't forget the QR code, do the survey. It's the only way you're going to get your CEs. And they will be uploaded in CE Broker and certificates will be sent via email. Thank you, Frank. Thank you,
Thank you
everyone.
all. Good night.
Have a good evening.